Hey everyone, and welcome to RUBIN'S Mind Lab, where we break down the latest research into what it really means. Ever wonder if there is a treatment that can actually bring back the joy in life for people suffering from depression, especially when other treatments haven't worked? Well, this new study might have some fascinating answers. Today we're diving into a really important topic, electroconvulsive therapy or ECT, and its incredible potential role in treating a specific, often overlooked symptom of depression called anhedonia. So, what exactly is anhedonia? Think of it as the inability to feel pleasure or interest in things you used to enjoy. It is not just feeling sad, it is a profound lack of joy. And here is the kicker. If you have a lot of anhedonia, you might not respond as well to the usual depression treatments. And your depression could stick around longer or keep coming back. This is a really big problem because most common depression treatments like medication or therapy just aren't great at tackling this specific symptom. In fact, some medications can even make it worse by causing emotional blunting. So we desperately need other options. That is where ECT comes in. It's often considered the most powerful treatment for severe depression, especially when other things haven't worked or when someone needs to get better really fast. The researchers in this study wondered if ECT, given its potent effects on severe depression, could also be a game changer for anhedonia. So, how did they try to find out? They looked at the medical records of 67 people who were already getting ECT for depression. They measured their anhedonia and overall depression symptoms at 4 different times, before ECT started, after their 6th session, right after their whole course of acute ECT was done. And then again, a few months later when they were in a maintenance phase of treatment. For anhedonia, they used a scale called the Snaith-Hamilton Pleasure Scale, or SHAPS. It's a simple questionnaire where people rate how much they can still experience pleasure. And for general depression, they used the well-known Montgomery-Åsberg Depression Rating Scale, or MADRS, which is rated by a clinician. They also used the Beck Depression Inventory IDE or BDII for self-reported depression. To analyze all this information, they used some pretty sophisticated statistical tools like multi-level models, which are great for looking at data that has repeated measurements from the same people over time. Think of it like tracking a person's journey through treatment. They also used something called CROSS, lagged panel models, to look at how anhedonia and depression influenced each other over time. Now, let's get to what they actually found. This is the exciting part. When they looked at anhedonia, they saw really significant, and I mean statistically significant, improvements. What does that mean in simple terms? After just 6 ECT sessions, people were already feeling measurably better in terms of their ability to feel pleasure. This improvement continued to grow and peaked by the end of the acute treatment. And importantly, these improvements largely stuck around even a few months later during the maintenance phase. The effect sizes, which tell us how big the change was, were large, meaning this wasn't a tiny, barely noticeable improvement. This is crucial. The improvement started happening early in the treatment. This rapid reduction in anhedonia is a big deal. Now remember how we said anhedonia can make it harder to treat depression. They tested this directly. They wanted to know if people who started with more anhedonia would see less improvement in their overall depression with ECT. And guess what? They found that this wasn't the case with ECT. While anhedonia might predict poor outcomes with other treatments, for ECT, the severity of anhedonia at the start didn't seem to affect how much overall depression symptoms improved. That is huge. It suggests ECT might be effective across the board, regardless of how severe the anhedonia is at the beginning. They also did something really interesting. They looked at the timing. Did improvements in anhedonia happen before improvements in general depression, or vice versa, during the ECT treatment? Using their advanced statistical models, they found evidence that early improvements in anhedonia might actually lead to or predict later improvements in overall depression. Think of it this way, getting back that sense of pleasure and interest might be the first domino to fall, which then helps to knock over the rest of the depressive symptoms. This is a really powerful idea. So, what does all of this mean? The study clearly shows that ECT is not only effective for severe depression, but is also remarkably good at treating anhedonia. It works fast, the improvements last, and it doesn't seem to be hindered by how bad the anhedonia was to begin with, unlike other treatments. This has major implications for how we treat depression. Currently, ECT is often a last resort, but this study suggests that for individuals with significant anhedonia, especially those who haven't responded to other treatments, ECT should be considered much earlier in the treatment process. It could potentially save people a lot of suffering and prevent their depression from becoming chronic. The paper also briefly touches on other treatments like RTMs and ketamine, noting that they might also help with anhedonia. However, ECT seems to be particularly fast-acting and effective when it comes to restoring pleasure and interest. Now, it is important to talk about the study's strengths and weaknesses. A big strength is that they looked at real patients in a real clinical setting, which makes the findings highly relevant to everyday practice. They also tracked people over time, which gives us a good picture of how ECT works. However, they also point out some limitations. The biggest one is that there wasn't a control group, meaning there wasn't a group of people who didn't get ECT to compare against. So while the improvements are clear, we can't say with 100% certainty that ECT was the only reason for them, though the rapid timeline strongly suggests it. Also, they mentioned that anhedonia itself is a complex symptom with different types. And their main measure mostly captured one type, consummatory anhedonia, which is the pleasure experienced during an activity. Future studies, they suggest, should explore if ECT helps with other types of anhedonia too. In conclusion, this research provides strong evidence that ECT can significantly and rapidly alleviate anhedonia in patients with severe depression. It suggests that we should reconsider when ECT is offered, potentially making it an earlier option for those struggling with the loss of pleasure and interest. This could be a crucial step towards more effective and personalized treatment for depression, helping people not just function but truly re-experience joy in their lives. What are your thoughts on these findings? Do you think ECT should be considered earlier for anhedonia? Let me know in the comments below. If you found this breakdown helpful, please give this video a thumbs up. Subscribe to RUBIN'S Mind Lab for more science insights and hit that notification bell so you don't miss our next exploration into the fascinating world of psychology. Thanks for watching, and I'll see you next time.